Hi there, everyone. It's Neil Sleeman here from Platinum Physiotherapy in County Durham, and this is the question time, or questions and answers. It's been very good the last couple of times we've done it, and we've had some great questions sent through today. So we'll just wait for a few more people there to log on there. We had a few more questions come in the last half an hour, which we've managed to add there as well. And then we'll probably spend about 5 minutes on every question, which we've got to get through them quite quickly. And the idea is to get as much information out to you as possible and keep these questions coming in. It allows us to keep you informed. Lots of different things happening at the moment in the world, obviously. And these questions hopefully are relevant to many of you there. Just to give you an outline of some of the questions that we've got tonight. The first one that related to an article that the Chartered Society of Physiotherapy actually sent around to all of us in the last couple of days regarding Googling, or Dr. Google, as we tend to call it here. It's quite interesting, this study. I'll certainly read out some of the interesting statistics that came out from what the CSP found. We've got a little bit of a chat about cycling. There's a lot of new cyclists during the coronavirus period, which is fantastic for cycling, get people active. But with that comes some considerations from the physical side of things. So a little bit of a chat about cycling, injury prevention, those kind of things. We've got the runners' questions that come about the running frequency. We did cover this in one of the Facebook Live posts at the end of April. I think it was the end of London Marathon Day. So I do have a look at that. We'll cover a little bit about the running frequency. What is the right running frequency, which obviously is a difficult question to answer. Everyone is different. And then we've got a hip question that we'll be talking about hip, returning to fitness after hip surgery, hip replacements and such like. So we'll start with the Dr. Google. We'll get started. Help or hindrance? I bet everyone's Googled something in the past. I'll Googled stuff probably relating to medical things that I wasn't sure of, certainly outside of my remit, but I wouldn't feel comfortable Googling a lot of the stuff I do know about, because once something's on the internet, it's there. And this study that the Chartered Society of Physiotherapy put out this week, I think it's actually on their Facebook page, is worth reading in full. It was about a whole lot of people were obviously interviewed and had a look at things that were out there on the internet regarding physiotherapy-related subjects. And these quite staggering statistics were found when they looked at all of these articles on the internet. Almost a half of them, 43% of these articles contained a myth. And this was reviewed by a large number of physiotherapists, obviously in areas that they specialised in. So the word myth is concerning that that will be available. The second one, that 60% actually contained false or misleading information relating to the subject at hand. 60% of these things that they found on the internet. 1/3, 32%, had an unrealistic video demonstration. An example was, and it's actually on the Facebook post on the CSP, how to self-manipulate your neck, your cervical spine. Now, as a physiotherapist of 20 years, certainly 20 years ago, would have been more likely to manipulate a cervical spine as a physiotherapist than what I am now. Things have changed, they've progressed, and therefore to be even considering self-manipulating your own neck in the context of the qualifications required in itself is not good. To then be following something on the internet, on a video that is unrealistic, is also not good. And then obviously the performance of that technique would be very poor. So that's quite a bad thing. You know, we would not support that. So that's 32% of these internet videos from Dr. Google had unrealistic video demonstrations all the way up into cervical manipulation. 40% of them had unhelpful language, which they consider as fear-evoking or contradictory. And therefore, 40% of these articles would actually take the patient the wrong way from the direction that they would, need to be going in. And that really fear-evoking language, we see a lot of that on the things that we hear about. And most of it is about the fear of movement. The very basis of improvement in the physiotherapy world is movement. That's what we're here to help people do. Therefore, if you have a fear of movement that is negatively reinforced in the context of Dr. Google, it's no good. It's not research. It creates problems. We find a lot of these things are around the back of the necks. Fear of movement making it worse. Obviously, humans were designed to move. We find a lot of this language in Dr. Google is around the discs of the spine, all the way from the neck down to the lower back. Language like the herniated disc. If you do this, you will get a herniated disc, is the language that these articles have. Interestingly, a lot of these then sort of piggyback into products. So therefore, if you have a fear-evoking presentation and the solution is a brace that restricts movement, it would make sense that they marry. And that's what we find. A lot of these Dr. Google articles, videos, whatever you want to call them, they're linked to a product which tends to marry, and we wouldn't support that on the basis that one size wouldn't fit all. That would be impossible to suspect. The other thing, if we're talking about herniated discs in the context of back or neck, without getting too much into that subject tonight, it would have to get to the MRI stage to have proof of a herniated disc. As physios, we can be suspected of a disc injury, but I will not say to a patient, you have a herniated disc. I do not have X-ray vision. I'm not Superman. I cannot see an MRI scan until I have one in front of me, and it's the radiologist's goal and job to tell me, was my suspicion of a disc injury there, and was it a small bulging disc, or was it a herniated disc, which is a more significant injury? It is not up to Dr. Google to say, you will have a herniated disc, let's buy a brace now and restrict movement. Therefore, the fear-evoking language of Dr. Google is something we often run into trouble with. And it takes a little while for us to perhaps build that trust with the patient, say, actually, we're pretty happy for you to do this exercise, to do this test in front of us. We're qualified to do this. This is how we diagnose, this is how we treat, as opposed to a video on the internet which has not had a look at your particular history, situation, assessment, all of the above. On the back of that was almost half of the videos found in this internet study through the CSP had no qualifications named in relation to that particular internet sort of article or video, 45%. So I think if there's going to be things on the internet with this sort of area of expertise, we need to know who's writing them, what are their qualifications, what do they specialise in, and away you go. Obviously, when we're putting things on the internet under the banner of physiotherapy, in our case, platinum physiotherapy, we are saying to you, we're qualified physiotherapists, this is what we specialise in, and this is what we're happy to talk about. I would certainly not be posting something about a car mechanic situation of which I know nothing. I would not be telling people how to cook, and I'm also not qualified to be commenting on things like that. So this is where I think the stats are quite astounding in this study. Nearly half had a myth, 60% had false or misleading information, 32% had unrealistic video demonstrations, all the way up into how to manipulate your own neck, which is a very dangerous thing to be doing, and almost half had no qualifications. So what we tend to find is the miracle cure tends to come into this, which we obviously do not think is a correct way to go about these types of things. They lead viewers to then, believe in where the product or such like is involved. 66% of the physios interviewed in this particular large study had said they had treated patients who had voluntarily offered information that they had found on the internet which had made them worse before presenting to the health professional, whether that be doctor, physio, other. So 2/3 of patients had actually voluntarily said, I tried this from a particular Dr. Google website, which may have fit into the categories above. So in terms of Dr. Google, our line is please feel free to ask questions of health professionals. Make sure you know their qualifications. Do not think that everything you read on the internet is the gospel. Always check the qualifications of the person writing the article. It's a good starting point. And then obviously being able to question those is the best way to go. So Dr. Google, help or hindrance? I think in the internet world, it is not necessarily a help all of the time. Self-diagnosis is not always the best part, particularly when people can't see you. So the second one is cycling, new cyclists. We had some cyclists that came to us and said, we're cycling a lot more because of the corona, often during the lockdown. That was one reason. And then the commuting to work has started to happen. And so that's really important. What do cyclists have to be aware of? Well, first and foremost, if you did get a new bike, is it the right setup? At the very basic level, the seat height is a good starting point, and we do get cycling injuries when the seat is too high or too low or the wrong type of bike. But hopefully you've solved that in the initial purchase or getting it off a friend and getting all that sorted. So getting the bike right is important as an injury prevention. It's, first and foremost, good place to start. If we then look at the key muscles, well, we've got our thigh muscles, our quadriceps, the calves get involved, particularly when we go up the hills and we're going out of the saddle. Neck and shoulder is a big one for new cyclists because they may not be as powerful. So therefore we have to consider the neck and the position. And are you looking up? Are you looking down? Where's your height of the handlebars? Are you wearing glasses? All of these come into play. So little testing periods on your new bike or used bike that you now use. is a good idea before you start going longer. Get the setup, get the position right. In terms of the effort and the power, a lot of new cyclists do struggle with that. What is the correct cadence? What gear should I be in? Have I used gears? Our advice would be probably better to gear easier until you've solved that. Get in a higher cadence. Get used to cycling. It might feel like you're not producing the power, but a new cyclist won't be able to generate the power for long periods. It's just like jumping into a weightlifting competition without doing any weights. You wouldn't be able to do that for long periods. So you need to work out how long are you going to cycle for. The effort levels will need to be conservative because your muscles will be sore the next day with the number of contractions they're doing, and that will help to make the muscle soreness less. In terms of recovery, like all cyclists should be doing, we tend to use the foam roller a lot more these days, and again, it would be the thighs, the quads. I'm just pointing to my quads here, the calves, the hamstrings, and even the backside is a very good muscle to be foam rolling as well. So new cyclists looking for that recovery, and then from that, the frequency of the next cycle will become easier to predict. You want to make sure you keep on the move the day after. Do a walk, cycle the next day, do a walk. So you can mix it up a little bit. You certainly don't need to cycle every day, but at the same time, if it's going well, then there's no harm in a gentle cycle, on most days of the week at this point in time. So the main things. Third one, how many runs a week? The runners, obviously, that comes with those questions, particularly the increased running frequency in Corona that seems to be very much across the world, and then certainly in the UK as people try and get out, particularly with the weather that we've had. So there is no magic number of runs per week. We treat people who are injured from running once a week, which might be new or old to their previous running history, all the way to people that are running as much as twice a day, 7 days a week, 90 miles a week if we have runs. So there's no exact frequency, everyone will be different, but there's some factors that would clearly come into play. Your experience of running, what you're used to doing, is this a new activity or is it not? Your injury history would definitely affect the frequency of running. Obviously, if you've got a major injury history, you would be less likely to be running every day. Were there any goals, whether they be races, previous or future? Were you training for an event? Are you doing it for fitness? Are you doing it to be out of the house to get some time out? Or are you doing it for well-being reasons, whether they be physical or mental? All these things will affect the frequency of running, which then maybe goes into the effort levels. Is it a jog where there's no watch, no expectations, you're just enjoying yourself, or are you actually up to the level where you need to be going at a certain pace for a certain distance? And that would then, be very important to get the frequency right. Are you doing any strength work? If you're going to run more, then you need to strengthen more to earn the right to run more. And that's the single most common cause of the injuries we see in runners, particularly at this time. They used to run this many times a week. They might have done a bit of strength work. Corona comes in, lockdown comes in, working from home comes in. Suddenly we're running more, but the strength work is the same. And now we've got a problem. The balance has completely gone the wrong way. So you have to be careful. If you're going to run more, you need to strengthen more in whichever way that might be. It could be cycling, it could be circuits, it could be stuff at home, it could be classes. And then you can balance and work out how many runs a week that you can do accordingly. Use the foam roller for recovery in exactly the same way, so that when you go for that next run, whether that be the next day or 2 days or 3 days, you've fully recovered, rather than going up to that next run with tight muscles in exactly the same way the cyclists would experience. You could get the same injury risk there. So recovery is important. And just getting the distances right, just being careful, vary it. Is there a shorter run? Is there a longer run? Is there an interval type run in there? Doing the same run every time, 3, 4, 5 times a week will almost always lead to injury, because the same muscle fibers are always doing the same thing. And if you're not recovering properly, increasing the frequency could cause an issue there. So that's the main thing there. But do have a look at that Facebook Live post. I think it was on the 24th of April. It's the London Marathon Day. We had a good discussion about that. Now, the next question there, hip fitness, or fitness in people that have had hip injuries, whether they be hip replacements, elective surgery, or traumatic hip injuries, which could be falls, broken hips, and then that may lead to surgery. What are the expectations, fitness, pre and post hip injury / surgery? I think we can divide this into the elective hip replacement versus the traumatic injury, because I think there is an expectation that could be different. The arthritic hip that has restricted that person for so long, whose ability to do activities of normal daily life and exercise would have gone very low over that period of time, would have the hip replacement, and if all goes well and the rehab goes well, they would actually get a very good, quick and continued result. So it's not unusual for hip replacement people in the medium to long term, 6 to 9 months, to be doing far more than what they were doing for many years, whether that be golfing, walking, cycling, and there is runners and there is skiers. And we do support people that have hip replacements early, which we've talked about on previous Facebook Live threads, because the early hip replacements do extremely well. Their goals are very clear, and often they do return to many activities and sports such as that. The traumatic fall is different because you don't know you're about to have that injury, which could be an accident, fall, skiing injury, cycling injury, whatever. If that ends up being a bony orthopedic problem like a fracture that leads to surgery, then it is different because your activity levels actually might have been quite high before you had that injury or surgery. You still have to go through the same rehabilitation if surgery is being involved, if normally it would be for this kind of injury. So therefore, how to get back to where you are is a little bit trickier, because the bridge between where you were and what you were expectations are is more difficult. However, the treatment is the same. We get the movement back, restore as much movement as we can post-surgery. We get the strength back as quickly as we can, and we keep on going with that strength work. And then obviously from an activity point of view and a fitness point of view, you want to target that towards your activity. So therefore the runners would have to do more running specific strength work, the walkers more walking specific strength work, and the cyclists more specific strength work there. So I think possibly the starting point for those people may be higher in terms of the muscle strength that they had before the accident, but perhaps they've really got to get that extra level of neatness to that strength work, which is more of a specific to the sport. Just restarting the running or the walking, the cycling, I wouldn't consider being neat enough, and that's hard, because once you're back through that rehab period, you just want to get back and doing what you were doing, particularly if it wasn't a long-term arthritic situation. You want to be back there straight away. So I think that the specificity of the strength work is the key. Keeping that regular, that should be part of the daily routine, possibly in the house, particularly in the corona. If you are getting back into running, walking, cycling regularly, again, the foam roller comes into play to loosen the muscles, to allow you to build up more strength, which then allows you to build up more fitness, and therefore the activity levels can remain high. And then I think similar to the cycling and running questions we've gone through, is mixing it up. Okay, so it could be the key. Cycling one day, walking the next day, doing your strength work every day. It allows you to keep building your strength, your cardio fitness, your activity levels, your functional daily routine, always doing more but safely, building up the strength, and therefore, again, we would expect continued progress from that. That's pretty much where the hips are there. So if there's any more questions there, I'm just going to have a quick look in the sidebar there, if there's any more questions tonight. Obviously, do feel free to message us or email us on the info at platinumpt.co.uk address. We'll probably do the questions and answer every week or so in between other Facebook Live presentations. And anything of interest, do let us know. We're happy to talk about subjects all the way from pediatrics, as a pediatric physio practice, all the way up to the elderly, everything in between. And certainly whilst the situations around with coronavirus, we're trying to talk about subjects relevant to that. So we look forward to your feedback. Please obviously share this video. People who couldn't log on now are welcome to watch it after. It will stay on the Facebook page there, and have a fabulous weekend. See ya.